everyone wants to know more about coronavirus or COVID-19. So we are gonna talk about it today. So, what is COVID-19? You may ask. So, it is also called as SARS-CoV-2, as it is a part of a different family of coronavirus. That so. There were three outbreaks of coronavirus basically, and this is the novel coronavirus 19. There was SARS, MERS, and the COVID-19 which is occurring today. It is also known as the novel coronavirus, okay, and also SARS-CoV-2. Now you may ask, where did it come from? Till now there is no complete evidence suggesting this, but it is considered that bats have it, as this was one of the natural hosts for MERS and SARS. Um, so is this virus comparable to SARS? You may ask. The SARS was done. SARS outbreak was at the end of 2002 in China, and it caused more than 8,000 cases in 33 countries over a period of 8 months. Around 1 in 10 people died who who developed SARS. So it had a very big fatality rate, but it was not that many cases. But COVID-19 has a bit less fatality rate, but it has a lot of cases. See, as of 30th March, there are 700,000 cases worldwide, and more than 30,000 who had died from coronavirus. So it's going very fast around the world, and now you see in India it's around 1,300 something. Yeah. Now you may, what is the mode of transmission? So the mode of transmission is when you sneeze or cough, the small respiratory droplets interact with someone who is in close proximity. So these droplets can land on hands or any surfaces near them. So if they land on hands, when you contact with our face, what happens is that virus seeps into your body and then later develops itself. I mean, basically it makes itself again and again. The This virus can survive several hours in copper or cardboard, but only a few days in plastic and stainless steel. So, but now we may ask, what's incubation time? You have maybe have heard this a lot, or you may have not. So, what's incubation? So basically, if you have coronavirus, there is incubation time. So basically, there's some time between you get the symptoms, basically the first symptoms. So it is estimated between 1 to 14 days. So the first symptoms to appear is called, for COVID-19, is called the incubation time. So you have already been infected, but it's not been shown to you. So it takes almost to 1 2 days to further small first symptoms, but it may also last for it may also take up to 14 days. So um, now what are the symptoms? And now the main thing, what are the symptoms of COVID-19? The COVID-19 symptoms are severe fever, cough, sore throat, general weakness and fatigue, and muscular pain. In more severe cases, there is severe pneumonia, acute respiratory distress syndrome, sepsis, and septic shock. So these all are related to COVID-19, and you may think, oh, it is so much near to the flu. It just is a basic flu, but it's not. It's completely different, and it doesn't even have vaccines. We are going to discuss it more later, and I'm going to also tell about the differences. This is provided by the ECDC, which is basically the European control of the diseases. So yeah, so some people more riskier than others, yes. So, people who are above 60, 65, or 70 have have more risk for developing severe symptoms of coronavirus, and men in these groups appear to have slightly higher risk than females. So, children make up very small quantity of all cases. Under 10 years, only 1% of all cases were reported which were having coronavirus, and only 4% are aged 10 to 19. So it is very less compared to the whole 100%, but it's still some percent. Okay, now you may ask, is there a treatment for COVID-19? No, there is no specific treatment for COVID-19, as there is no vaccine till now. It may take up to months or even years for a vaccine to come, as it needs to be tested and ready to be used for humans. Now you think, should I be tested for COVID-19? If you develop certain symptoms which are related to COVID-19, try to be tested. If it becomes like more worse, please go to a doctor to test yourself. So where can you be tested? You can go to the you can contact your local healthcare services online or telephone. So you can get a laboratory test for that if you really are having coronavirus. I mean, if you really look like having coronavirus. So there is also there is also like allergy or pollen allergy, which is basically like a flu. So now we need to differentiate between them. So this pollen allergy, before that we need to learn about this pollen allergy. It is when you feel very itchy. It is also known as seasonal virus. When you feel very itchy, nasal congestion, runny nose, and sometimes even wheezing and skin rash. So this is around um, a pollen allergy. And allergies are not been identified as a very major risk for COVID-19 yet. We don't know if it's completely true, but it is not identified. Now we need, this is the most important part of this lesson. How can we differentiate between hay fever, pollen allergy, we just learned about them just now, between COVID-19 and also common cold? So this is a beautiful differentiation map. So you can look through it. I'll just stop it for a second and you can take photos. Okay, some more. Yeah. Okay, I think so. You have taken. You can pause to take it. Yeah. So this is the differentiation between fever, COVID-19, and common cold, and I think it is very easy to understand, and you can find it. You can think what are the differentiation, and understand that you may have COVID-19 or a common cold, the differentiation between them, or even a hay fever. So that's it. Now this is also a very important part. Prevention. How can you be avoid getting infected? You see in India there's like 21 days of lockdown, and there's also that social distance yourself. Now you may think, why they telling this? So this is nothing but, you have seen that the virus is transmitted by cough, sneeze, everything. So if you social distance yourself from people, what happens is, or when you lock down yourself, what happens is, those people can't I mean, you can't get a COVID-19 like diseases on top of surfaces, as there are no people in front of you. So there's no people who have coronavirus in front of you, which makes it very very hard. So you can't even imagine, it's nothing, you can't even think of it, it will not even come. So if you stop like going out or even social distancing yourself from people, you can prevent it by a lot. Now, there's also some more things, like if and all it comes to your hands, it doesn't mean it will come to your body, as it can't seep through your hands. So you need to wash your hands very carefully and avoid or reduce touching your face. It is estimated that you touch your face at least 16 times per hour. So we need to decrease that. That's the only way that it can seep through your body. And you need to wash your hands for 20 seconds, as soap is the only thing that can avoid coronavirus, because the soap particles attract the fat um, outer shell of the COVID-19 uh, COVID-19 virus, so it will not allow it to avoid it from going it. I mean, it will let it go, so it will not let it come to our body basically. So that's one way to prevent it. So we need to start sanitizing ourselves very often, so that we reduce the risk of getting it. Now, if how can you avoid it? So you see, in the incubation time, you don't know what's happening. You don't know if we have COVID-19 or not. So in this time, like if suddenly you get coughs or sneeze, use your elbow, or use your tissue, and then carefully dispose it it after you used it. And then you need to wash your hands for 20 seconds at least, or sing your happy birthday song twice. Okay. Now you need to stay 1 meter or more away from people who are COVID-19. This is one reason there is lockdown and um, social distancing practices for COVID-19, as it's one of the way you can stop COVID-19. Oh, sorry for marking up that. So see, what is physical distancing? I just told you about it just now. It is also known as social distancing. See, what should you do if you get develop symptoms of COVID-19? Call the local COVID-19 helpline, or you can go to your public health authorities. So, are face mask effective, you may ask? So, if you are not infected, the use of surgical masks may reduce the risk of getting infected. On the other hand, there is no such evidence that face masks will prevent it. But for safety purposes, let's just use it for going outside, as it will be a bit more harder for the virus, I think, to come inside, but there is no complete evidence for it. Now, is there a vaccine against the virus? This is a very important, this is a very asked question, but there are no. It may take up to months to years for the COVID-19 vaccine to come, as it needs to be tested and ready for the human use. So we have no virus. See how long it will take. The development of virus vaccines takes time, so it may take up to uh, it may take up to months and years for the vaccine to be widely used, because it needs to be tested for thousands of people, not only like 50, 100. No, it needs to be tested for 1,000 people, nearly thousands of people. That's why. So this question is also very asked. If you have influenza vaccine, it doesn't mean that you're protected against COVID-19, as they are very different viruses itself. So no. So this all is for the ECDC. So basically, it's for the European. So it's not related to us. So yeah. You can see this in the description if you want. Yeah, you can see, I'll send the link in the description to check the whole website. This is a very good website, I tell you. You can see all the things about it. So now these things. Okay, now what precautions should you take if you travel by airplane, everything? Travelers should adhere very strict hygiene measures. So you need to wash your hands with soap very regularly, and touch the face. We don't touch the face, and you need to reduce it. So it's all about the prevention, as it may take up to 14 days for the virus symptoms to appear. Now, what is the risk of infection while traveling by plane? Yeah. So the risk of infection on airplane cannot be excluded, but is currently considered very low. Okay, for an individual passenger, but it is still there. So we need to be very careful. Still. So now people see the incubation time. It may take, as everyone tells, it may take up to 14 days. Okay, so people can just walk into the screening which is occurring in India and all places, because the virus symptoms are not appeared and you can't feel your fever, you can't feel it very hot the body, so they just let it in. That's the reason it's the screening is not effective for for seeing if they have viruses. And that's the reason people come to places even though they may have coronavirus. So be careful. So now if you get any packages, it may persist up to 24 hours. So 24 hours, not days, okay, sorry, 24 hours on the on cardboard, which most of the packages come from. So but there is no evidence of the infection ever been transmitted through contaminated packages that are exposed to very different environmental conditions. So we can be a bit careful for that as well. So there is no evidence, but just for safety purpose. So there's also some things called disinfectants. So these are some things, like if there's a cardboard, we can't see the virus. But if you use there are some things called disinfectants. Uh, so they stop the virus from occurring. So that's also one thing. If you can, you can buy it and you can put it on the frequently touched objects such as the door handles, the table, etc. So now, if and all if people work in careers, they are not in a greater risk of getting COVID-19 as a result of managing packages. So couriers delivering packages at homes are advised to keep a distance from the customer. Sorry, yeah. Use We need to use alcohol-based hand infectant frequently, or also known as basically sanitizers, very frequently, and avoid working if shown signs of respiratory symptoms. Now, what is the risk of COVID-19 infection from food products imported from affected areas? So, there is no such report of transmission of COVID-19 via food, but we need to be very safe. We need to, for safety concerns, we can, we, I mean, for safety concerns, we don't know, but we uh, wash all the food products very carefully. But there is no such evidence, so it's just breathe once extra time. So there is also no evidence that animal products or animals uh, pose a very good risk, or pose a risk of getting COVID-19. Okay, so these are all. Now there's also things that if you get contact with pets, are there any kind of COVID-19 risk? Okay, so if there are any dogs or cat, there is no evidence of that companion animals pose a risk of getting COVID-19 to humans. However, there is one report from Hong Kong of a pet dog that had a positive swabs and showed serological evidence that it has been likely infected by its owner who got COVID 19. As a general precaution, it is always wise to observe basic principles of hygiene when contact with animals. So, this is the end of the COVID 19 session. So, this is the um, whole thing about COVID-19. So if you want to learn more about it or check this whole website, I'll throw it in the link down in the below the description. We will like to get a subscribe or even share it to people who don't know about this all. So sorry for the background noise, as we had very less time for shooting this video, as we wanted to uh, tell people about the COVID-19.